Hey guys, Federalist again. I saw this video about there's an ongoing debate regarding healthcare. People keep referring to Canada and to Europe as a better way uh, for socialized healthcare, single payer system. There's a lot of advocates out there. Um, I don't know, man. You have to look at. I know people from Canada. One of my family members married a guy from France. Um, Basically, these people have nothing good to say about the single payer systems. There's a reason for that. Um, you have to, it's not free. I suppose at this point, there's nothing more that needs to get said than if free to you means it comes out of my taxes and therefore I never have to worry about anything again. I think you're crossing up a few things. Uh, Basically, there's a rationing body in these countries that basically says you will or will not receive this kind of health care. If these drugs are too expensive, you won't receive them. You know, you'll just be expected to just die. You know, just sit there dying. We'll treat you with other things that are not effective or less effective. If you're too old, they're just going to tell you to go home and die. Not in so many words, of course. They're going to gloss it over and make it nice, but you know, I'm sorry. You people that think that America's wonderful healthcare system that we have is just going to just suddenly become free. And you're going to pay a couple of bucks more in taxes if you pay taxes. You know, and that's going to be, it's just going to be this wonderful thing. You know, suddenly the clinics and the doctor's offices are just going to burst open and you're going to be invited in for free everything on every, you know, it's just going to be awesome and wonderful. Our healthcare system is going to decline. And it's going to eventually run into a system like Canada where you wait around to see a doctor who really is just a general practitioner, and then we're going to start getting into ration care. A lot of people, I think, have a very unlearned view about what exactly happens in these countries. There used to be a great healthcare system in Germany and France and all these other places, and in Canada. Unfortunately, the fact that it became socialist and the rules that went along with government money flowing into those programs became so strangling that a lot of people decided not to choose to practice medicine. It was something they were thinking about, and then they just decided, no, really, if it's going to come, I'm going to have to be dealing with, you know, very, very gross, I mean, bloody, crappy things that I have to deal with, and having the constant stress of life or death. You know, the only thing that really drives people to do that, there's some people that do it for the love of humanity. And to those people, I say you could choose no better way, you know, to express your love of humanity than to practice medicine. But there's just not enough of them out there that do it for that reason only. And unfortunately, wealth is the reason that people practice medicine and become specialists and do these other things, because they've found that they can do it. They can tolerate the blood, the guts, the broken bones, the, you know, accident victims who are torn apart, and they're trying to put these people back together. They see that as a way to become wealthy so that they can, you know, pursue their life's dreams and goals. And there's nothing wrong with that. You know, they're still doing the job. You know, a lot of people that do that job, I mean, hats off to them. They've got a lot going for them. They're smart people. They're very able people, and they were willing to commit to a life that was going to fill them with a lot of things that are sort of to normal people would be like, I couldn't do that. I couldn't deal with all the gross stuff that goes on. I mean, broken bones sticking out of arms and whatever, and bloody whatever, and stool samples, and you know, don't get me started. I have people that I know and love that are in the medical field. But I don't think you're thinking clearly if you think that the American system, you know, if we start this whole single payer system, that it's going to, number one, it's not going to walk hand in hand with the private care system. If you think that, you're a fool. They're already writing language into this bill that will ensure that you must have the government system if by the end of this year, if it gets past this August like they predict it will, or that they're pushing for, you must either be in a private plan or you must be in the government plan, either A or B. So, and pretty soon, you know how it works. You know, government gets involved in something, and it just makes it more difficult for private sector, if not impossible for the private sector to keep up with it. And at this point, I think I see a lot of people out there who are basically shiftless goofballs. We have, these cradle to gravers like hippies, that live in their mom's basement and they can never get a good job because they refuse to quit smoking the dope or whatever, or just acting lame. And there's people that just act like they're so, so hurting. They got this backache that just won't go away, and it gives them a little trouble, so they can't have a job. All these people think that it's just going to be, I'm going to have free health care. It's going to be awesome. And then that entitlement mentality is going to take over. And what we have in America is, I believe, the greatest health care in the world that you can actually get is going to go away, because the clinics, the doctor's offices, the specialist offices are going to be filled with people with that sense of entitlement that they get something for free. And the people that pay taxes, they're going to be like, oh no, I'm going to get to the head of the line because I pay for something. There's just going to be a lot of animosity. There's going to be a lot of problems, and I just foresee this thing going down. I really do. The entitlement people are just going to be like, oh, this is great. Now I don't have to worry about a thing. I can skateboard off my roof if I want to, because I've always wanted to try that. I saw it on TV once. And if I break all my bones, it doesn't matter, because I got free health care. I'm going to go get myself patched up. I'll be right back at it in a month. It's going to be great. And this is just, it's going in a stupid direction. You cannot have, the government is going to eventually swallow up all of healthcare, and it's going to turn into a single payer system. We already know from looking at examples in Europe like England, where now they're having to sort of relinquish healthcare into a private sector alternative because they can't handle it. They just can't handle it. In Canada, the same thing. So watch Steven Crowder's piece. If you don't know who Steven Crowder is, jump here on YouTube and just type Steven Crowder, Crowder. He's a comedian, but he did kind of the Michael Moore thing, where he went to Canada, where he has dual citizenship, and he found that, wow, we're sitting around here for 4.5 hours for somebody just to even look at us in a crowded waiting room of a hospital, where he had a friend that had, he had faked that he had a broken wrist, or he had thought that they had kind of made this scenario up where he had a serious injury, and he waited around until he finally was they left. After 4.5 hours, there was a guy there with a broken clavicle, and they just basically, the guy waited 9 hours, and then they had to refer him to somebody else the next day. I mean, this is craziness. But do you want it to descend into that? Because for sure we're going to scare good medical practitioners away. We're going to have ration care, and the only reason this is going anywhere at all, the only reason this has traction in the slightest, is because we have more than 50% of the people in this country. Here's democracy at work. Democracy. That means mob rule. That means that the more illegal aliens that show up on our doorstep, unskilled laborers that just mob over the borders at night or whatever, have kids here and start mooching off of our entitlement programs that are already in place, the more people that drop out of society, the more people that just get fed up and drop out, because they're just getting leached to death, and they're just sick and tired of paying taxes for somebody else to hork up and to use for themselves. There's a lot of reasons people are dropping out, but we have dropouts. That's the problem. That's the only reason this is getting any traction at all. Let's just face it, we have an entitlement mentality here in America. Certain people are, go on believing that they're owed something for previous transgressions of prior generations, and we have people who believe that the system has done them wrong, and they're out for retribution. And it sucks that the have-nots get to vote themselves a raise from the public trust, for the public treasury, based on their own laziness. I don't want to work. I want you to pay for me. That is the worst possible mentality. I can't even believe it's going on. But now it's crept into everything. It's just gone insane. It drives me nuts. And to have people sit there and think that it's going to be just a wonderful day when this is all going on, it just drives me insane.